Let's look at calf pain assessment. Remember the calves. There's two muscles in particular we're going to talk about here, the gastrocnemius and the soleus. And a key difference between the two is that the gastrocnemius crosses both the knee and the ankle, where the soleus acts upon the ankle. So when it comes to our testing, we want to be able to differentiate between the two. Has our client strained their gastrocnemius or their soleus? So we're going to do our three tests, active, active resisted, and a passive stretch, but we're going to do them with a straight leg, so extended knee, and with a bent knee, which will help us identify gastroc or soleus. Let's review a pain behaviour assessment for a client complaining of calf pain. It happened a few days ago. You want to establish what's going on. So they describe pain in the mid-calf area, so could be muscle, could be tendon, you're not quite sure. Here's some tests that will help give you some more information. Of course, the first thing we're going to do is our normal SOAP assessment. This is another tool that we use to add into our assessment in terms of hypothesis and treatment planning. So we also want to start by just doing that visual assessment and palpation as well. Are there any signs of redness, inflammation, bruising, cuts or damage? Also on palpation, is it hot, cold, clammy? And also just palpate, can we palpate where that client is feeling the pain perhaps? But again, this is a very gentle test. And do remember, if you do palpate and it has a pain response for the client, remember that 10-second rule. If the pain is increasing after that 10 seconds, that's indicative of tissue damage, so come off that tissue. Okay, so that's another indicator of acute damage. So here we want to establish, is it going to be tendinous or muscular, because that might change, one, what we're going to treat, and two, our home care, for example. Also, it will help us identify perhaps the stage of injury the client is in. As well, in terms of the calves, there's more than one muscle there. So we're going to look at two possibilities here, the gastrocnemius and the soleus. The gastrocnemius crossing two joints, so we're going to test that with a straight leg, so putting that gastroc on a little bit of stretch before we do our active, active resisted and passive stretch. And then to try and isolate the soleus a little bit more, we're going to do the same tests but with a bent knee, so making that gastroc a little bit more relaxed. So we want the foot to be able to move freely off the end of the bed, so I'm going to remove the pillow and then ask my client to shuffle down so their feet are off the bed. Excellent, thank you. So the first thing we're going to do is an active contraction. So can you please point your toes for me, plantar flex. Any pain, and where do you feel the pain? Okay, so the where is important. If they can't describe it, then ensure that they show you by touch where they're feeling that pain, and relax. The next test then is active resisted, so I'm just going to come down to add some resistance to the client. And again, can you point your toes for me? Any pain, and where do you feel the pain? And relax. And the third test is a passive stretch. Okay? We can do this in standing, like we do for MET, and I'm just using my knee to bring that foot into dorsiflexion. Any pain, and where do they feel the pain? Again, we're not so worried about joint capsule here. They report the pain well away from any joint, but I want to understand, are they feeling it in that Achilles tendon, or indeed are they feeling it in the muscle belly? Also, are they feeling it on initiation of that contraction? Same three tests, but now let's do it with a bent knee, because that might tell us it's a soleus. That might change, one, our hands-on work, because we want to be getting deeper to that gastroc as we progress through the injury healing stages. And two, it's also going to change our home care. The exercises we're going to give them will target soleus more than gastroc, for example. So I'm going to bring that knee into 90 degrees of flexion and do the same three tests. So can you point your toes towards the ceiling for me, please? Any pain? And where do they feel the pain? And relax. Active resisted, so I'm just going to place my forearm on top and point your toes up towards the ceiling. Point them up. That's it. Any pain, where do you feel the pain? And relax. And the third is to then just bring it into a passive stretch. Do you feel any pain, and where do they feel the pain? And relax. So that's a really simple way to help you, one, identify the difference between soleus and gastrocnemius, and two, to help you understand if this is a soft tissue related issue. Is it something you can work on, or is it something you need to refer onwards?